taken my kids when they were real little, we would just sit them like, it was like an inch deep, and then as they got bigger, we went a little bit deeper.
Okay.
But
Is
maybe
that still going around right now?
right?
Massage.
But around most of it, there's like a curve or a lip, but I thought there was pretty, yeah, I think it,
How long do you have to sign up for it?
Like if you're getting somebody else to do it too, is that what you're saying? I think they take people pretty close up to the time that it starts.
Okay.
I think they'd like to have everybody an idea of it, by the orientation, so they can really make the plan a little bit better.
Yeah.
But I don't know if there's a set date. I don't think that they turn people away. Okay, so let me just put this up here so you guys can see it one more time.
should ask you about that.
I am gonna post this on the back, door, but, and it also has the orientation time here at the top, so make sure if you don't write it down right now, that's where it's at, so you can reference it.
Oh, so give her a little encouragement.
What's that? Give you that. Okay, so, thank you guys. We're getting into massage now. Yay! So, I don't have much of a lecture, but I do wanna go over it just briefly, and then we'll get into lab and kinda go over more of the technique involved with it. So this shouldn't take very long to kind of run through this part. Would you mind hitting the lights? Yes. Thank you. Get you guys going on this. You guys all ready to give massages? Before we talk about receiving the massage.
Right, yeah.
Okay, and then your families will love you because you can practice on them.
My husband's very willing to be a patient now,
Sure.
No.
Alright,
before he was a
so, massage, there is a certain type of massage that we do in physical therapy versus what massage therapists are, although there is a little bit of overlap with that. But massage is mainly used for manipulating the skin or joints. It is thought too that, kind of, it could loosen a joint or bind structures within a joint, depending on the type of massage that you do. So it kind of goes back a long ways, massage, but it's gotten a bad rap over the years. So, so it kind of goes back to several different, countries kind of have their own form of massage. But in the past, it was kind of looked at as like a negative, like, massage parlors and like, that type of look, and it still kind of is that way. But, over the years, things have kind of changed, and I wanted to point out a couple of things on here. So it does talk a lot about that in the notes here, where it's like it had a bad rap, it was looked at as this. But over time, people continue to try to make an effort to show the benefits of it, of healing through touch. And so I want to point out a couple of areas. There was like 8 different people that kind of started this chartered society. It was for gymnastics and kind of medical background. They kind of formed this program that was more rigorous that they wanted people to go through, and it allowed for more of an understanding of what was involved with that and understanding the body and the tissues and things like that. So it was an effort to try to change that stigma that was attached to massage, but it still kind of was there. So then once the polio epidemic came along, that's where things kind of started to shift a little bit more, because they started to see that there was benefit in the process of when a body's starting to become paralyzed, that massage was actually showing benefits to that purpose. So then it started to be viewed a little bit better. And so that's where it started to change and be more accepted by everybody. Although it still has a little bit of a stigma to it. So moving into the general overview real quick. Physical therapy, now there's the certified massage therapist and there's physical therapy. We do, like I said before, we kind of overlap a little bit, but it's starting to be, massage therapy services are starting to be approved through insurance now. You might even see massage therapists as part of a physical therapy clinic. And that's for, the purpose of like relaxation or whatever it might be that patient's needing. They might go to the massage therapist at the clinic where PT can focus more on specific impairments and function for that patient. So it's utilized sometimes in combination with each other, or maybe there's times where you just do a little bit of a massage to a specific area because you know that tissue needs it. So there's two different types, like I said before. There's recreational massage and there's therapeutic massage. So recreational massage is more of your relaxation type of massage, promotes healing and kind of decreases stress levels, things like that. But there's not really a health issue. There's just the form of massage to calm you and relax you. Okay. Therapeutic massage is this is where it overlaps a little bit. It is stress relief, it is a healing, but it also gets down into deeper tissues where you're finding out those structures and maybe even getting into deep friction type massage. Honestly, a lot of times with physical therapy type massage, it is almost uncomfortable. So depending on what tissues you're getting into. And you still have to be very careful because you want to start the process going smooth. Start off gentle, get into deeper tissues, and then get even farther into the deeper tissues with like a friction type massage or trigger point type massage. And those are really uncomfortable, trigger point. So, you guys probably all know that, right? Like if you get a knot or something and you're like, and you start pressing on it, it's painful. Okay. Going into some of the basics of massage. So these are some ideas of what we need to be thinking about: ethics, hygiene, hand preparation, the media that you're using, positioning and draping of your patient, your body mechanics, and breathing. Your breathing and the patient's breathing. Okay, so let's go into each of these. So ethics is just talking, kind of going back to the idea of touch. You want to make sure you're doing appropriate touch, right? So you're starting off, and we'll go through the different techniques. There's one called effleurage, and that kind of introduces the touch to your patient and you to the patient's skin and what you're going to be feeling. You're trying to identify the structures as you know them, the muscles, the bony landmarks, things like that. And so it takes a lot of experience to really identify areas of tightness, but that's where that first introduction to your patient is going to start getting you used to what you're feeling. Okay. So it's kind of all dependent too on how much pressure, and that's going to be based on your patient, or the speed, the rate of your movement, things like that. And we'll talk more about that now. So hygiene goes into the next part. So of course you want to make sure that you wash your hands. Hygiene also is talking about your, like, just the smell that you have, that you give off, like if you smoke. If you wear perfume, lotions, things like that. It's supposed to be a calming experience for your patient. And so once you smell something that's unpleasant, it ruins the whole purpose behind it. So that's what you have to be thinking about too. It also goes into, in your notes, use of illegal drugs and alcohol. Of course, as a therapist, that's not a good thing. So you should not be using illegal drugs. And if you do drink alcohol, you just need to make sure it does not carry over into your working life. Maybe you have a hangover and you're still not okay the next day. You probably shouldn't be at work. So anyway, but it does go into this as well. And also for a patient, if they had any alcohol within 12 hours, massage is not really beneficial for them. So, and the purpose or the reason behind that is because alcohol dehydrates your muscles. The massage is going to dehydrate them further. So it's just going to put them in a place of feeling extremely sore at the end of it. Okay? So sometimes you want to ask your patient, I wouldn't expect you to do that in your lab exam, but sometimes if you're concerned, you want to, yeah, not look for you to say that. But it's cause of concern with a patient that you smell it on them or something, and you want to make sure that you're educating them in that process as well. Okay. Hand prep. We just just talked about washing your hands, but also making sure that you are clean, that your nails are fairly short. So I don't always massage. They are actually, yeah.
The alcohol thing, is that because of its blood thinning effect?
No,
Or
just
just so
for
they don't get-
dehydration.
Okay.
Yeah. Making sure, like, you don't want somebody massaging you that has like filthy nails, right? All the dirt and nasty hands. You're like, don't touch me, I'm good. I'm fine all of a sudden, I'm healed. But also keeping in mind jewelry. So, I already took off bracelets, rings, but you probably wanna do that today and put it in a safe place. So you don't want it to get in the way or pressure on your patient or the lotion or whatever it is that you use and get in there and erase it myself. But also talking about hands, these are kind of the areas that you can use to do massage. So whole hand, palm or surface of your hand. You start getting into ulnar border, and we'll talk about specific techniques and how you do that. Your fingertips, your finger pads, your thumb. The only thing I would recommend is not to overuse your thumbs. It gets very tired and it would cause a lot of pain over time. So don't do too much with your thumbs. If you start getting where you need to get into deeper tissues, it's okay to use other parts of your body. Again, I wouldn't be necessarily looking for that in your lab exam, but just being aware that you could possibly even get elbow into deep tissues.
We won't get dinged for using our thumbs in the lab exam?
No, I just want you to be cautious of that in your future, that you wouldn't want to excessively, as you start learning now, you want to not get in the habit of constantly going back to your thumbs. So then you know that over time, that that's probably not good on your joints. But no, you will not get deep on your hands. And honestly, a lot of the techniques that we're going to talk about do not involve really just the thumb, it's more the hand. So. Okay, media is referring to what you're going to use on your patient for that massage. So you could use nothing. It gets a little bit more friction involved there, so it depends. You might find that times where it's more beneficial to not have something involved. But otherwise, things are like baby oil, powder, lotion, petroleum jelly's on here, or gel. We do use lotion, and it is water-based. So you might still check with the patient, do you have any problems with lotions? This is more water-based. Usually that's not any reaction from a patient when it's water-based like that. So, anybody in here have trouble with various lotions? Okay, we do have the ultrasound gel, it's probably not as enjoyable as the lotion. But, okay. So the next part here, positioning and draping, this is referencing back to your 150 information. So this is how you position a patient. If they were in prone, where do they need pillows? So let me ask you guys, where should they have pillows?
The chest,
Do the
yeah.
hips.
Okay,
Ankles.
and usually you don't need like the entire structure, so under the hips and under the lower leg.
Under their head.
So actually for massage, we're gonna be doing the face cradle, so just making sure that that's covered, okay? So definitely be thinking about where pillows go, because again, it goes back to relaxation of your patient. They might say, no, I don't want a pillow, but really, most people are more comfortable with a pillow, so just have them there for them, okay? If they are in supine, where would you put pillows?
Under the knees.
Head, under knees, and then possibly another one at lower legs if it needs it, but usually that's enough. You don't need to like support the arms or anything like that, okay?
Pillows under every extremity.
Yeah, honestly, that rarely happens. So you usually don't have enough pillows for that anyway. Okay, so just make sure that you're referencing back to 150 if you don't remember. If it's sideline positioned, which could be, if there's a pregnant patient, they have to be on their side, maybe can't be on their stomach. How would you position pillows?
Between the legs.
Between the legs,
The back.
so maybe the back, but maybe you need to get to the back, so you need to have them kind of lean a little bit more forward and hold onto a pillow in front of them. So just think of your, like, what would be comfortable for me? If you're really like, I can't remember where the pillow is supposed to go, like what seems comfortable? That's usually how it is. Okay. pregnancy is actually left side. Mhm. Yeah. So,
You put them on their left side. you don't
left
put 'em on
side,
your right side.
because that's gonna allow for more blood flow to.
Well, no, I was just thinking like, on someone else.
Yeah. But it is, yeah, it's not about like like crushing or anything like that, it's more of allowing the blood flow to run the way it needs to. Okay, body mechanics. So this we've talked about last semester, and of course it will continue in every semester, but massage especially, like if you're constantly doing massage, this gets exhausting on your back, so just make sure you're very comfortable with how you're positioned. Usually the table height needs to be about where your DIPs, PIPs kind of sit if you were to relax your arms here. And then imagine there's still a body on here, so it's not like I'm leaning way down. There's still somebody you have to massage, right? So, and then you want to make sure you have a wide base of support. And usually kind of a staggered kind of stance. So you can kind of move from one leg to the other side and keep it kind of fluid in your motion, okay? So it shouldn't be very robotic looking or anything like that. You should have a nice fluid motion, okay? Breathing, make sure you're breathing. But don't hold your breath. It's just gonna make it different experience for your patient, more pressure sometimes if you hold your breath. Also, if the patient's holding their breath, maybe something's uncomfortable for them. So you should probably identify what's going on and remind them to breathe normal throughout that massage. And we'll get into specific things with respiratory type massage. We'll talk more about that on Monday of next week. So I'm gonna skip a certain section of these notes when we, because we'll talk more about that next week, but that does have to do with breathing as well, so we'll talk more about that. Massage used as an assessment tool, so like I said before, you know, you get to know the tissue, and you find areas. Like sometimes the patient will be like, oh, move over more, and my husband does that to me, drives me crazy. I'm like, I'll find it, just stop talking. So, but anyway, so, and you will find it with more experience. Like, you want to try to warm up the entire area and get the tissues used to it. So you start off slow, and then you work up to deeper pressure. Right? So you will find those areas with more time. And maybe right now, too. You just got to kind of be more aware of the body and what you know of the muscles, where structures are located, things like that. And, you almost close your eyes and try to visualize like what you're feeling. Like, what muscle is this? How do those fibers run? If the fibers run this way, how should I be massaging that to help that particular knot that they have? Okay, so, and you'll get more used to that, like I said, with time. Documentation. We usually document massage as STM, so it's soft tissue massage, STM. But you'd also want to identify like how long of a massage was it? Was there any particular area that was a problem for that patient where you found like a kind of a knot in the muscle? When I say knot, do you guys know what I'm referring to? Like it's almost like a speed bump. It feels like a little speed bump. Okay. Identify if you did soft tissue massage or if it was deeper tissue, more pressure. So it just kind of gives you some examples of the things that you would want to include in your note. What was their pain before? What was it after? Any questions on that?
Would that be an instance where you might put patient response in assessment
Yeah, and I
instead
actually,
of just subjective?
yeah, I used assessment as that most of the time with my patients. So if there's something, like your subjective information, fine, you just greeted your patient, they gave you a pain rating, that's probably subjective. Once you get into your treatment, and if there's something that you did in treatment that directly affected their reaction to it, that's where I would put that in an assessment. Now, you can possibly still put it in subjective, but it almost makes like more sense because it follows something you did. You would just have to identify how. So like post soft tissue massage, patient's pain decreased from this to this. Okay. Or maybe you notice something change in the tissue and we would identify it in your assessment as well. Okay, so this section, a lot of this part is gonna be your, more of your lab notes, but I do wanna go over a couple of things. So, like I was talking about before, a lot of it depends on the amount of pressure that you're giving, the rate and rhythm of it, and how long you'd even do it for. Now, I can't tell you every massage would be this amount of time, because it's all based on what you're feeling in that with your patient. Maybe you start noticing that tissues are relaxing a little bit more, and you want, it's kind of like, oh, this seems like it's loosening enough for me to do the next part of our treatment. So it's more of a judgment based on what you're feeling, and also what the patient can tolerate, okay? So the pressure direction, is the same exact thing. A lot of it does depend on your patient's tolerance with this. Again, you can use your pain scale to identify how things are. I don't want you guys to be overly questioning your patient, like, how's the pressure, like, that's not relaxing, right? When you're constantly being asked the same thing over and over again. But you also wanna have a lot of awareness, like, are they breathing during this? Maybe occasionally, like, is that pressure okay? Maybe you start off asking it, like, how does that feel, after you've done a few kind of techniques of it. And then as you start changing into more of a deeper pressure, you do a few of them, and then you ask them, how's the pressure with that, is it okay? But you wanna identify, like, more of like, it's hard to say observable signs, because if you're working on the back, they're face down, but just be aware of like how their body's responding to you. Okay? A couple of things, the directions, I want you to be aware of that as well. Centrifugal direction is just talking about away from the heart, kind of moving from the center outward, whereas centripetal is talking about the opposite, is moving towards the heart. And it does kind of talk about, I don't really know that this necessarily has to always be that way, that's why it says generally, but light strokes are usually away from the heart, whereas deeper pressure is more towards the heart. I wouldn't say it's always that way though. This is kind of a general understanding of that. Okay. And then I've already kind of talked about some of that already, so a lot of it, like it says, it depends on your patient. Okay, so the massage techniques are what's listed here in your notes. So kind of a general term, effleurage. Yes.
Is the direction, would it be like origin to insertion?
Usually you do move more proximal to distal, but it kind of changes around too. So it doesn't have to be that way, but usually that's kind of how we want to think of it. And actually, let me start on that for just a second. So thank you for asking that. If you had a limb that's really swollen, like imagine the lower leg, it's really swollen, you wouldn't want to move distal to proximal. And the reason being is you could get too much fluid and overload the heart. So you want to start more proximal and work your way down the limb, okay, to try to kind of eliminate some of that fluid that's building up in the limb. And actually it's referred to as uncorking the bottle. So you might write that down. But uncorking the bottle, kind of like I said, it releases fluid so then it can start to flow and you work your way down. Okay. Proximal, distal. Thank you for asking that. Okay. It's harder on the back. Proximal is more center. Distal would be more away from the center of the body. But it kind of all blends together a bit when you're working on the back, unless you identify a specific muscle and you work your way from center out.
So you said uncorking the bottle is loosening.
Yeah, so you're trying to get more proximal, like releasing fluids more proximal than disc. You're starting proximal and you're working your way more distal. Does that answer your question? Okay. So effleurage is kind of how you start and finish massage, okay? That's really important in your lab exam too to understand that. So you start with, it's also known as gliding strokes, although most commonly referred to as effleurage. So just know both terms, of course. But this is, like I said before, you're introducing your touch to the patient, the tissue of the patient to you, okay? So, and then you're also applying your media, which is like your lotion or whatever it might be, kind of warming up the tissue for that. You can also go back to effleurage in between. It's like a kind of transitioning type of motion. So if I'm doing effleurage and then I find a specific stroke under petrissage that I want to use, I can kind of in between that go back to effleurage, okay? And I'll talk more about that in lab. Okay. In effleurage, you usually kind of start off with this for the first 2 minutes, at least. You could do more depending on what you're feeling with your patient, but it's usually kind of general rule is about 2 minutes. And then you move into whatever else you want to be working on, and then you can kind of go back to effleurage. Now, every time you go back to effleurage, it doesn't have to be 2 minutes, but usually kind of the start is 2 minutes. Now, when you finish up with effleurage too, kind of think about that same type of time frame, like 2 minutes of effleurage to finish out your massage. Okay, so now going into petrissage, this is kind of a general or a category that we're talking about with petrissage. So there's several massage techniques that fall under this category, okay? So petrissage is starting to get into the deeper tissue, and we are going to go through each of these. So kneading is one of them, and it kind of talks a lot about how it's done in more of a written form, but so if you need to go back to this for your own thoughts and process, but we are going to practice this more in lab, so I'm not going to go into too much detail on how this is done right now. But kneading is one of the terms. Then going into picking up, so this is like showing the picture here, you're picking up the tissue and then kind of relaxing it back down. Now tissue does get kind of sticky, like there's fascia that sits underneath and it can get stuck. And so your whole goal is to try to loosen that, keep it mobile. Okay? So that's one of the things that you can do to help relax it a little bit more. Ringing is another term under petrissage. And it could either go back and forth where you're pushing tissue back and forth into both hands, or you can go like side to side. So depending like on the limb, maybe you're doing it on the leg or the arm, you might go like this more than pushing side to side. It doesn't have a specific, like I have to do it this way. But you just need to make sure you're doing the right technique with the massage term. Does that make sense? Because you can go side to side or back and forth, or maybe you kind of put them together as you're doing it. It doesn't matter. Okay. You just don't want to be weird in how you transition movement. Okay, have it still have a fluid motion. Okay, skin rolling is another one. So this one sometimes feels good, sometimes doesn't. So it depends on the person. You pick up the skin and you kind of move it with your thumb, and then kind of walk with it. So yeah, it seems kind of like it sounds kind of creepy, like moving up your back, but it just depends on the person. Okay, so those are all the different petrissage techniques that we talk about in class or in lab that I would expect from you in your lab exam. There are several more. If you go to a massage therapist, they'll talk about a whole bunch of different ones, but that's not what we're doing in this. So those are the only ones you're required to know about for lab. Yeah.
Are we gonna have to demonstrate or name those?
Yes, you will. So when we practice in lab, I'll show you what it looks like, and I'll run through several of them, and then you'll have to show me, as you're doing it, I'll ask you, which technique is that? And then you can't just say petrissage, because that's kind of a general term. You can say petrissage, but it's this one in particular is kneading that you're doing. Okay. And usually you kind of try to find a flow, so you kind of run through each of them in order. But it doesn't have to be that way. It might help you in learning it and being able to present it back in a lab exam, so you don't miss something. Okay. The next one is tapotement, or also known as percussion. So this one gets into even farther structures or deeper tissues. And it can be used, we'll talk more, we'll pull this one into respiratory therapy next week as well, but it can also be used on like a relaxation. It sounds rough sometimes, and actually the terms sound terrible, but you're not going to say to a patient what these terms are. which you'll see in a second. But it's just meant for your own understanding. So clapping, or it's also known as cupping. It just says cupped hands, but it can be referred to as either. So you're kind of doing like a lumbrical kind of, your lumbricals are being used right here, where you kind of have like a little angle in your hand. Okay? You keep that, and then you kind of go on the back or wherever, whatever structure you're going to be on, back and forth. It does sound like galloping a horse when you guys all start doing it in the lab. It sounds funny. But, one second. So as you're doing it, just make sure that you have, like, as long as the body mechanics are good, wide stance, you want kind of the motion to be coming more from your wrist than like your elbows or your shoulders. Okay, just kind of keeping nice and relaxed as you're doing it. Yes.
Is that what's typically used for cystic fibrosis?
Yes. Yep, and we'll talk about that next week. Okay, and actually there's chest vests now that they have that help out with parents who don't have to do all this stuff. Okay, so clapping, and that's kind of what it looks like right here. Beating. See, said it sounds terrible. But this one is talking about, like you just kind of loose, you don't want to clench your fist, you want a loose fist, and you're kind of doing that same back and forth motion, but with loose fists, okay, back and forth. Okay, then it goes into hacking. Okay, so this one you're using more of the side of your hand now. And so again, same concept, like loose wrist back and forth. But as you're doing this, you're thinking about it striking the last 3 fingers, okay? So that's what's gonna contact your patient as you're going back and forth. And again, all wrist, you're not getting elbows, because then it's too forceful, okay? Okay, pounding. Oh, that sounds terrible. Okay, so this one, it's kind of like beating, but now you're turning to the side. So same idea, loose fist, and you're more on the ulnar side, and you're going back and forth. So really it's just a matter of, okay, which one is this, which one is this? Make sure you're doing the right one that I'm asking you about, okay? Or you're telling me anyway. Yeah, so let me just go back through them real quick. So cupping, show me with your hands, okay? And then going into beating. Okay, you're right. Okay, beating would be like pronated, loose fists, okay, like this. Hacking, kind of ulnar side, kind of like the karate head. Chop, but make sure again your fingers are kind of open and loose. Okay. Okay, and then that was hacking now. Pounding. Okay, so again, you're more on the ulnar side, open fists, loose fists, on the ulnar side. Okay, you guys already know it, right?
What does that mean when it says alternating wrist pronation and supination?
So you're not like, you're keeping it kind of going back and forth. Like, your motion is loose and fluid, rather than like,
You're pounding on
yeah, I'm going like just set like this. I'm like allowing a more fluid. It's kind of going pronation, supination when I'm trying to exaggerate it a little bit. But yeah, you're just not staying like straight plane motion. You're keeping like a fluid back and forth. Not really. Because once it strikes, you're kind of coming back up. Yeah. You don't like hold it and do anything. You just kind of keep it nice and loose. Okay. Vibration and shaking. This is the one I was talking about before that we're going to go into on Monday. So this is definitely more related to your respiratory therapy, and the reason you would do it would be like fluid buildup in the lungs. Cystic fibrosis is an example of that, which it's done a lot for. So with these, you'd find a specific section of the lung, like a lobe of the lung, which you guys are going to learn next week, and you would get a specific section, find it, hold it, and like you're using your hands to kind of press on that section, and you're kind of doing this shaking type motion. Vibration and shaking honestly kind of go together. They're, even the respiratory therapist, our director over here, she's like, you don't really separate it. but it does kind of identify them differently, so I just want you to be aware of that. But you find this specific section, you kind of push back and forth, and they take a deep breath in, and as you're doing this, they're like hissing almost out, so they're getting all the air out. So they're doing like an S sound, and you guys will practice this on Monday next week. So as you're going, and somebody's shaking you, it's supposed to be getting more and more air pushed out. And then after they're done, they would try to cough to expel more like mucus. So you'd have a trash or something nearby so they can spit. Okay. Okay, so this is kind of an example of it right here, what it would look like. Like I said, we'll go over it more on Monday. We're not gonna do that one so much today. Deep friction, this is the last one. So there's two different types, transverse friction and circular friction. Transverse is you're going the opposite direction of those muscle fibers. And then circular, you're gonna identify an area and kind of go in a circular motion. And this one you do tend to use your thumbs a lot more just to get those deeper tissues. But like I said, certain structures you might have to go with elbow. I wouldn't expect you to do that, and I don't want you to do that in your lab exam, getting the elbow, because that comes with time, okay? So just with these ones, you'd probably use more of your thumb. But these ones, like with this, like just watching my thumb kind of go back and forth, this is the circular friction. With each time you go around, you're almost going deeper and deeper into the tissue. So you'll find an area that's tight or has a knot or something, and that's what you would do here, where you would use it. Trigger points are a little bit different. You'd find a knot, you'd press and hold it, like a lot of pressure on it, press and hold until it kind of relaxes, and then you let go slowly.
Can you do the transverse friction in the air again?
Transverse, so if my muscle fibers is like this, like rhomboids say, somebody's standing in front of me here, they're like this, I would go like this. Okay. Questions here? Okay, the last section is just going over the effects of massage. So this is, I think we all know a lot, like generally speaking, it's a relaxation. You're supposed to get calm, your muscle tissues are looser, but blood flow increases. Some of this has a lot of like what does that mean? So I just want to make sure I'm talking about it real quick. So again, blood flow. Stretches superficial tissues, so it's loosening up those tissues. Like if something's like tight underneath, like a fascia, you want to can't talk. Stretch those tissues by moving them around and getting more mobility. Loosens the scar tissue, so these types of massages, like when you start getting into deep friction massage, definitely helps with breaking up adhesions that form on scar tissue. So adhesions are like binding structure that holds some, it's kind of like connective tissue that binds structures together that you don't really want to break things or to combine and bind like that. So you try to break up those adhesions as much as possible by moving it around. Now, if somebody has a scar, usually it's not comfortable. It almost feels like, describe it as like pins and needles, like when you press on it. Okay. It's really good for them to continue to do it, like vitamin E, like oil or whatever on a scar, and like it's really uncomfortable. So they should keep doing it though. Okay, this was like, what does that mean? So fibrosis is just talking about like cellular material that kind of forms in a muscle, and with denervated muscles, that means like that muscle is not as functional as it used to be. So it can be taken over by extracellular fluid, or I shouldn't really call it fluid, it's just like cells that kind of take over the function of a muscle. And so you want to try to keep the massage going so it eliminates how much that's taking over the actual muscle. So we, just keep, for paralysis purposes, think of it like, okay, don't want the muscle to completely go away, even though it's starting to atrophy. I still don't want extracellular structures to take over. Okay. So what I talked about before, this dislodges mucus from the lungs. If you're doing like more of your percussion, even your clapping and things like that, you could use with those respiratory therapy type patients. So you want them to expel the mucus with a cough at the end of your massage. And then last, the whole purpose of this, like stimulating the heart as well. Physiological effects, we talked a lot about this already throughout the entire time. Opens the blood vessels to allow for blood flow, increases the blood volume because it, allows for that blood flow to run through. This one here is skin sweating, decreasing resistance to galvanic current. You're gonna learn about E-stim next semester. So if the structure in the tissue is too bound or tight, it won't allow for currents to kind of run through it as smoothly as you want it to. So massage might help to decrease that so currents can get to where you want it to. Relaxation of your muscles, of course, which we've talked about. Increases urine output, and this is actually something really important that you're going to educate your patient on post-massage, that they drink plenty of water because it starts to release toxins that are in the muscles, and so that goes through your kidneys, and you want to make sure that they're flushing that out with drinking a lot of water and getting rid of that so it doesn't stay in the body. And then decreasing edema. If they are, I'm kind of going into a contract, which we'll talk about in a second, so I'm going to hold back my thought. Reflexes, once you start touching and massaging a patient. Again, vasodilation is just referring to opening of the blood vessels to allow for blood flow. They'll get goosebumps. Gooseflesh, I know, it's kind of a funny term. And then relaxation, overall relaxation. They also have psychological effects, relaxation, we've talked about comfort, and then going into like more of like a sedative, like, oh, this is very comfortable. Okay. Indications for massage, we talked about this, it helps with relaxation, it helps to relieve pain, and it helps to mobilize the tissue. Contras, it looks like a big chart. So you do have to be aware of your contraindications and make sure you state contraindications in your lab exam. All massage is listed right here, all the ones we just went over: effleurage, petrissage, percussion, potement, and vibration and shaking. All of them have these contras right here. So that's large open wounds, of course you wouldn't be doing massage. You'd be doing it over a large open wound. Cancer, that would just spread. Serious infections. Gross edema is referring to like, not just edema, regular edema, you want to use more caution with that, but gross edema is where the skin almost is like doughy when you press on it. And it's like a pitting edema, I don't know if you've heard that term before, where you press, if you press into somebody that has gross edema, you press into their skin, it'll like hold that indentation for a long period of time. So that would be gross edema, not like ew, gross. It's really referring to a specific thing. Yeah. Usually, if you're doing it, it's going to be near an area that probably has it. So,
I just didn't know for sure.
completely stop. Now, actually, we can go into it here in a second. It does talk about like heart conditions and things like that. But if they have congestive heart failure, you would not be doing a massage because you could overload the heart, especially when I shouldn't say you shouldn't be doing massage, but you shouldn't be doing more of the edema type massage because that will overload the heart with too much fluid and the heart can't compensate for what's coming. Okay. And so that's where it can kind of fall with that a little bit.
Interesting.
Did I say specific just now? Oh, well, I did say for edema. So there is a specific one for like lymphedema,
Oh, okay.
that you definitely wouldn't probably do that if they have congestive heart failure. Okay, so lacerations, bruisings, things like that, you wouldn't go directly over that either. Okay, and it does talk about foreign bodies. Of course, if they have glass or anything in their skin, you're massaging, that's not really feeling very good for that patient, so of course you'd be thinking about that too. Going into the next one, as far as contraindications, this is like more of your petrissage your more deeper tissues. So things like if they have a DVT, you wouldn't be doing it with that. Muscle tears, you wouldn't be doing it with that either because it's bringing too much blood to the area, and it already has blood in the area from a muscle tear. Right. So if people are like, oh, I just pulled enough muscle in my neck, massage it, that's really not benefiting that person because they just have a tear to a muscle, and by you adding more blood, then it's not going to make it feel fast. So. Okay, percussion and vibration. So these are more of your respiratory type therapy. Contraindications would be a flail chest, which is where a rib has detached from where it needs to be. So you would be very, very cautious that it would puncture something, and you wouldn't want that to happen. And then, of course, over the thorax with things like pulmonary embolism or heart failure.
Would gosh, how do you say it? Apoptosis or whatever, where atelectasis, that'd be involved in it too.
It would, yes. And it doesn't even go well. Like, there's a lot more. You have to use your judgment on some of this stuff too. Okay, precautions. So these are things that doesn't necessarily stop you from doing massage, but you should definitely be aware. So chronic swelling. So there is benefit to doing massage with swelling. You just have to be careful, like we talked about before, how much swelling, do we have congestive heart failure? It should start making you think that there's other things that could cause problems. Skin conditions, you don't want to spread or have any problems with that when there's skin conditions present. So kind of look at the skin before, it's like a skin integrity check before you even begin. Varicosities, like if there's increase in the, that's talking about like the elasticity of the veins, and if there's too much blood flow through the veins, usually you see that more like in the legs. Radiation, hypertonic or hypotonic limbs, not saying you couldn't do it with those. We'll talk more about what that is next semester, but hypertonic would be talking about like spasticity, which you kind of learned about that, right? Last semester. Hypotonic is when somebody's more flaccid, they're like loose, so there might not be benefit to doing massage with that. Just talk about extremely hairy areas, just use caution. You might have to shave, have patients shave areas if it really needs to be done.
Would you do that as well?
You shave them? No.
I got an EKG.
Yeah, but you as a PTA, I would not, because I mean, all I think of, like, if you were to cut them or anything, like,
Oh, okay.
just don't even.
I was like, I got you.
I'd be like, here you go. Have your family member take care of that for you or something. But, plus I don't want to do that. So, okay, bony regions, just being more cautious over bony prominences. You know this already by palpation, it just gets more tender when you're over certain areas. So I don't want to go over all of these, like you guys can read these, but I just want to point out specific things. Like we talked about pregnancy already. If they are pregnant, you might not necessarily want them lying on their stomach. Put them on their left side. Okay? All right. Any questions? Yes.
2 questions. Marked varicosities, what about like spider veins? That's not a thing,
Not
right?
necessary. It's just more of a precaution, so you just want to use your judgment on that.
And what if they have like a tackle box of piercings? You need to have them take some of those out, or just
Probably. It would probably get in the way for massage, yes. That's funny. Yes. You never know anymore, right?
yeah?
For the serious infections of the tissues, TB, what does the massage do to that?
You just
Would
don't
it just
want.
exacerbate the symptoms?
Yeah, and like honestly, the thought is like spreading to other areas, so just avoid it completely. I
So
won't get into
the,
too much detail on
sorry.
that, but yeah, no.
So
it's fine.
the congestive heart failure, that's a contradiction for all of them? Or was that only for the deep?
That's when you start getting into. It wasn't really listed as one of these, so I don't necessarily.
Yeah, because I know like it says at the bottom,
Yeah,
like a
it's only
Q.
under this one here.
Yeah.
Actually, it does talk about arterial and venous pathologies under the other one as well.
Okay.
What I was talking about more was if they have an increase in like lymphedema or like the gross edema, that's where you
Okay.
have to, it's more of a contraindication
gotcha.
of that. I kinda added that in.
Okay.
Other questions? Okay, so let's go over to the small room. So if you'd like